So today we're going to take off from the first video that we did about neuropathy. How do you know if you have neuropathy and how do you test for it? Today we're going to get into the specific testing of neuropathy. Okay, so we have Dr. Angie Franco here is going to be our mock patient today, all right? And we're going to just go through how we would evaluate a person with neuropathy in their feet or symptoms of neuropathy in their feet. Something like coldness, pain, numbness, tingling, burning, pins and needles. Or again, if the motor nerve is affected, we would see things like balance issues or weakness or cramping or spasms because when they get fatigued. So the way we would test for this is we use a 16-point sensory exam. This is based on the Toronto scale, okay, which is internationally known for grading neuropathy, okay? And so we're going to start with some of the things that we would do. We would do a cold sensation. So this has been in the freezer, so it's very cold, and we would be comparing the nerve to see if she felt the coldness in her arm the same as she felt it in her foot. That's one of the tests that we do. We also do cool because it's more sensitive. So we would take something that's metal and we would again test it and see if it's the same. If it's a loss, we grade it on a scale of 1 to 10. If it's less, then how severe is it? This is all part of the scoring system. Now, it should be the same. If there's no nerve loss in those particular nerves, it should feel the same in the arm as it does in the foot. The same thing goes for light touch. So we use some monofilament and we have her, can she feel it here? Yes, do you feel it here? And we test 5 different points in the foot to see if she can feel the light touch. We also do pinwheel. Pinwheel is for small diameter pain fibers. This is sharp, and so again, do we feel the sharpness the same here as we feel it here? We go across the top of the foot to grade it. We'll also look at the progression of neuropathy because unfortunately, neuropathy is a progressive degenerative condition. So over time, what happens is it gets worse and it affects larger areas, affects more nerves, and it causes more damage. So we take the pinwheel, we go from the foot up the leg until the sensation changes. And when it starts to feel different, that's the first area where the most damage is. And sometimes there'll be a second area that could sometimes go all the way up to the knee or even further. And then after that, we're going to do one of the most important and sensitive tests, which is vibration. Vibration is used to test the large diameter afferent nerves. These nerves do not sense pain. So people that have a loss in these areas, they don't commonly complain of pain. They complain of an unusual sensation. It feels maybe tight in their foot, or they actually just say, man, my balance is just not good. I don't have good balance. I don't have good walking ability. So we take the vibration, we compare it again to the upper extremity, to the lower extremity. It should be the same. If it's not, we grade it on a scale of 1 to 10 for loss. This is overlooked most commonly in neuropathy cases. This is the most common first symptom to show up, and it's the one that affects and makes you more of a fall risk, which actually makes this loss is the most dangerous because it actually, you can end up having a fall, having a head injury or something else that can ultimately affect you the rest of your life or even take your life. So very important test. On top of that, we also do heat. Okay, so this gets hot and then we compare the heat and we do the medipin sharpness to see if they feel the sharpness the same. We take all those and we evaluate them based on the severity scale and we come up with a percent of damage. Based on the percent of damage, we see that if you are less than a 20% loss, you have acute nerve damage, meaning it's new. Okay, if you get into a 20 to 40%, you have moderate nerve damage. This has been going on a while. When you get to this phase here, you're going to be looking at sometimes for the nerve to completely heal somewhere between 9 and 12 months. So you must have a plan of recovery that's going to involve home care, maybe nutrition, as well as maybe in office care to get this thing to completely heal and to give it time to recover. If you get into severe, once you get above 40%, all the way up to 80%, that is severe. This can take 12 to 18 months to completely heal and recover. And there is a permanent nerve damage above 80%. If you have above 80% loss, you will have some permanent nerve loss. Doesn't mean you can't improve or in some things, but you will still have some symptoms, unfortunately. So it's very important to catch it as early as possible. It's where you have your best outcomes, your fastest recovery time. The longer you let it go on and you just try to cover up the symptoms, taking gabapentin or whatever else the doctors prescribe, the more it will progress and the more damage it will happen. And not only will it get worse in your feet, it'll come up the leg, and then it can begin to affect the hands as well. So in a lot of cases, we do the same test for the hands as well to see if there's beginning to be nerve loss there. So I hope this helps you understand that your case has not been properly evaluated unless you have been through the sensory part of the neuropathy exam. So I'll see you on the next video where we're going to actually go through the number one reason why nerves die, okay, and how do you test for that, and then we'll talk about some solutions. Until then, live life well and God bless.